My name is Yelena and I'm 47 years old. I live in Illinois with my amazing husband and our 3 kids. Life is super busy and it's beautiful. When I met my husband online, he accepted me for who I am, including my journey with IgA nephropathy. We've built this beautiful life together and I feel incredibly lucky to have his support. When I'm not with my family, I work as a gastroenterology RN and I love what I do. My own health journey is what led me into medicine. I was active growing up. I played basketball in high school and I even have a better shot than my husband. I was first diagnosed with IgA nephropathy in high school after a routine sports physical. I was extremely tired. Friends would come over, come on, let's go out. And I'd be just so exhausted and I just wanted to be home in bed. That's when I saw a nephrologist. And unfortunately, my IgA was progressing quickly. Back then, there weren't any treatments specifically designed for IgA. Only a couple years after diagnosis, my kidney function declined so much that I had to be on dialysis. And I remember my first day going to the dialysis clinic. Everybody's 80, 70, and here I am 20. I'm totally freaked out. I didn't even do it, I went home. And the doctor called and said, you gotta go back, this is really important. Living with IgA has shaped my life in so many ways. I missed homecoming. I quit basketball. I quit everything. I didn't do anything in school. It was tough missing out on sports, but it also taught me to appreciate every moment with my family. After 25 years, my nephrologist told me my IgA was progressing. Hearing that was difficult, but this time I had options. My husband did a lot of research online, and that's when he came across TARPEYO. He noticed that it was the first FDA-approved treatment proven to reduce the loss of kidney function in adults with IgA. So when he came into the office, the doctor actually was aware of the medication, and he had said that that was going to be his course for my treatment. My doctor discussed the potential benefits with me, and with the help of TARPEYO Touchpoints program, everything went smoothly and we were pleasantly surprised. I don't have to pay anything for TARPEYO. It made the whole process feel less overwhelming. I take 4 TARPEYO pills each morning on an empty stomach, and then an hour later I have breakfast. It's just part of my routine. My eGFR numbers look really good. My protein levels have gone down. I'm ecstatic. I've had slight weight gain, but I work out, I try to swim, I stay active. I'm already through 9 months of TARPEYO and I'm feeling better. It took me 4 months to see results of taking TARPEYO, but I'm really glad I stuck with it. This was my experience with TARPEYO, and everybody's is different. As a gastroenterology RN, I find it very interesting how it has a connection between my gut and IgA. I actually asked some of the doctors at work about how it works in the gut. To anyone considering TARPEYO, my advice would be asking your doctor if TARPEYO would be an option for you. It doesn't hurt to ask. My goal is never to have dialysis again. I feel like my IgA nephropathy is in my hands with TARPEYO.
Important safety information. Do not take TARPEYO if you are allergic to budesonide or any of the ingredients in TARPEYO. See the end of the patient information for a complete list of ingredients in TARPEYO. Before taking TARPEYO, tell your healthcare provider about all of your medical conditions, including if you have liver problems, plan to have surgery, have chickenpox or measles, or have recently been near anyone with chickenpox or measles, have an infection, have high blood sugar levels, prediabetes or diabetes, have glaucoma or cataracts, have a family history of diabetes or glaucoma, have or have had tuberculosis, have high blood pressure, hypertension, have decreased bone mineral density, osteoporosis, have stomach ulcers, are pregnant or plan to become pregnant. TARPEYO may harm your unborn baby. Talk to your healthcare provider about the possible risk to your unborn baby if you take TARPEYO when you are pregnant, are breastfeeding or plan to breastfeed. It is not known if TARPEYO passes into your breast milk or if it will affect your baby. Talk to your healthcare provider about the best way to feed your baby during treatment with TARPEYO. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. TARPEYO and other medicines may affect each other, causing side effects. How should I take TARPEYO? Take TARPEYO exactly as your healthcare provider tells you. Your healthcare provider will decide how long you should take TARPEYO. Do not stop taking TARPEYO without first talking with your healthcare provider. Take your prescribed dose of TARPEYO one time each day in the morning, at least 1 hour before a meal. Swallow TARPEYO capsules whole. Do not open, chew, crush, or break TARPEYO capsules before swallowing. If you miss a dose of TARPEYO, take your prescribed dose at your next scheduled time. Do not take 2 doses of TARPEYO at the same time. If you take too much TARPEYO, call your healthcare provider right away or go to the nearest hospital emergency room. What should I avoid while taking TARPEYO? Do not eat grapefruit or drink grapefruit juice during your treatment with TARPEYO. Eating grapefruit or drinking grapefruit juice can increase the level of TARPEYO in your blood. What are the possible side effects of TARPEYO? TARPEYO may cause serious side effects, including effects of having too much corticosteroid medicine in your blood, hypercorticism. Long-time use of TARPEYO can cause you to have signs and symptoms of too much cortisol, a stress hormone in your blood. Tell your healthcare provider if you have any of the following signs and symptoms of hypercorticism: acne, bruise easily, rounding of your face, moon face, ankle swelling, thicker or more hair on your body and face, a fatty pad or hump between your shoulders, buffalo hump, or pink or purple stretch marks on the skin of your abdomen, thighs, breasts, or arms. Adrenal suppression. When TARPEYO is taken for a long period of time, chronic use, adrenal suppression can happen. This is a condition in which the adrenal glands do not make enough steroid hormones. Symptoms of adrenal suppression include tiredness, weakness, nausea and vomiting, and low blood pressure. Tell your healthcare provider if you are under stress or have any symptoms of adrenal suppression during treatment with TARPEYO. Risk of immunosuppression. TARPEYO weakens your immune system. Taking medicines that weaken your immune system makes you more likely to get infections. Avoid contact with people who have contagious diseases such as chickenpox or measles during treatment with TARPEYO. Tell your healthcare provider right away if you come in contact with anyone who has chickenpox or measles. Consult with your healthcare provider regarding appropriate vaccination scheduling. Tell your healthcare provider if you develop any symptoms of infection during treatment with TARPEYO, including fever, feeling tired, chills, aches, pain, and nausea and vomiting. The most common side effects of TARPEYO include swelling of the lower legs, ankles, and feet, high blood pressure, muscle spasms, acne, headache, upper respiratory tract infection, swelling of the face, weight increase, indigestion, irritation or inflammation of the skin, joint pain, increased white blood cell count. These are not all the possible side effects of TARPEYO. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see full prescribing information.